welcome to my channel. My name is Jasmine. You may also know me as Scrubs, Curls, and Coffee on Instagram. It's so nice to finally get to chat with you guys and kind of introduce myself and give you guys a brief overview of my little nursing journey. And this is my baby girl, this is Onyx. I've been in class all day, so she's been home by herself, so she's kind of needing some mommy time. But as promised, I promised you guys I would give you a video soon, and so here I am. So let's get started. So I am a second year, I guess that makes me a sophomore nursing student of an accelerated BSN program in my local area. But I just wanted to give you guys a brief background of where my journey officially started and why I chose nursing. And if this interests you, or if you're slightly interested in nursing school or even pursuing a nursing career at all, please stay tuned. Go grab some water, some popcorn, and some snacks and just kind of chill out and do a little bit of chatting with me. And don't forget to like this video, subscribe, and also leave comments in the comment section as well. Alrighty guys, so originally my degree, I got my associates in finance and accounting. I had all intentions on going the full route to become a healthcare administrator. Right after high school, I did an internship with the CEO of my regional hospital where I worked. I've always worked in a hospital facility. I've always loved working with people, but I just never knew if I had what it took to be a nurse, or if I was smart enough, or if I could even pass chemistry. That was honestly my biggest concern, was passing chemistry. And so that is why I went the finance route. I'm like, I'm a business girl. I don't want to be in scrubs. I don't want to deal with poop. I don't want blood all over me. Like, not for me. Okay, so fast forward to reality. I did obtain an entry-level finance job while going for my bachelor's in business, and I hated it. I thought that healthcare administration was something that it was not. It's kind of like the dark side of healthcare almost in finance. I can't speak for all administrative jobs in healthcare, but it's a lot of things that they don't tell the patients that I did not feel comfortable doing, or being that middleman in the middle between the hospital and the insurance companies and having to deliver that information to a patient, or let alone not tell them the full honest truth, because they do kind of like, I don't want to say hide things, but they kind of don't extend the full information to the patient, which I just didn't agree with. And I felt as though my purpose was to help patients, not necessarily get money from them or make them agree to something, or I just hated the environment, so it wasn't for me. So I did one summer of full nursing science courses, and if you aren't sure what those are, that includes anatomy and physiology, microbiology, chemistry, inorganic, organic, and biochemistry, statistics as well. So that was a lot for one summer. My chemistry classes were 5 weeks, Monday through Friday, 8 to 4. It was a lot of work, but I can honestly say it was so worth it, and I learned so much in that small amount of time that summer. And so I did some research about different schools in my area and didn't want to be in school for 4 years. And I also know that I didn't want to do the LPN route because I wanted to work in a hospital. I wanted to work in critical care. I wanted to be competitive in the nursing industry. Nursing is high demand. Nurses are always needed. You will always have a job. But I knew that I didn't want to take that LPN route, because now many magnet hospitals are requiring you to have your BSN, or at least be enrolled in school to be one. So that's what drove me to apply to accelerated BSN programs. Now we do have many in my area. We had a 24-month program, an 18-month program, and I think the fastest one was 12 months. And I knew that I needed a little bit more time than that because I did not have any nursing foundation at all. So then that's when I applied to Chamberlain, and I had all of my science courses done, many of my general education courses done with the exception of a few, and they told me that I could complete my BSN in 2.5 years. And for me, that was perfect because I knew that I needed a little bit more than 18 months, and I just felt as though it was a perfect fit. I took the HESI exam, which is a nursing school entrance exam that you have to take, and I passed with flying colors. I would say you do have to prepare a little bit for that test. However, it's more like a high school graduate test. So it's like a test with all the subjects, science, math, and English, and reading and writing. And so if you aren't that good at like pretty much Algebra 2, I would suggest you brush up on that by getting one of those HESI examination books that they help you review and over all of that information. And it's really big on anatomy because you need that for nursing school. It's all about the body and how the chemistry works, and there's also chemistry on there as well. So it's kind of comprehensive, but it's not bad as long as you prepare and review for it. So fast forward to actually being in nursing school. My program is an accelerated BSN program, so everything's 8 weeks. Each session is 8 weeks. So we have 2 sessions in a semester. So that's equivalent to a traditional school 16 weeks. Weeks is a lot to digest in nursing school. It's a lot of information. We have to take health assessment, Fundamentals 1, and now I'm currently in Fundamentals 2, Fundamentals of Patient Care, which includes my first clinical, which I had my first clinical on Thursday, and it wasn't what I was expecting. I can't say that it was bad, but I can't say that it was what I thought it would be. It was kind of depressing. Our first clinical is in a nursing home. It's a long-term care facility. The patients, the residents are so nice and they're so sweet, but they also, it's kind of sad. It's a place where, depending upon your mental status and your health condition, you might not be able to leave the campus or the facility. And it kind of seems like adult jail. I don't know, it's just not something that I could go to work every day. It's kind of a sad place, but it also brings light to situations where there's neglect happening in nursing homes. However, this one that we specifically are at takes excellent care of their patients. I was very impressed with the cleanliness of the facility and how well the residents are treated. So I'm impressed with that, but overall, I just like the hospital environment. It's a lot faster pace. It's nice to hear all the residents' stories and be able to interact with them because I am a critical care tech, so I do work in the ICU in addition to being a nursing student as well. So it's nice to have patients that can talk to me that are not intubated and sedated or violently trying to attack me. So overall, my first day was a great experience. It's just a little sad and depressing. Okay, but we'll talk about that later. Maybe a different video. I'll discuss my clinical and how to balance work and school all in one. But yeah, so I'm in pharmacology right now, which is a beast. It's very difficult. It's very hard. But my advice to nursing students with pharmacology is to remember your suffixes in your classes, and then from there you will excel. Don't try to remember every single drug or you will lose your mind. It's impossible. Your mind, it's impossible. Lose your mind, it's impossible. And I would also say to utilize your resources. You may not always have the greatest professors or the most knowledgeable professors or people who can teach. You may be knowledgeable, but it takes a specific type of person that can teach people where you feel as though you're learning. Some people can't do that. So I bought the Saunders NCLEX. I would advise every nursing student to seriously buy this book. It has absolutely everything that you need, and if you always try to read all the assignments that they give you in nursing school, it's yeah, it's not gonna happen. It's kind of impossible. It's like 400 pages a night or something, and you trying to digest all that information and retain it, it's just gonna be impossible. So I would not overwhelm yourself. I would utilize your resources. Use the PowerPoint with your best friend. Usually, from experience in the past, professors use the PowerPoint as a guide because they won't even read books themselves because it's just way too much information to digest. So if you stick to the PowerPoints, review those, practice. I cannot stress how important it is from day one of nursing school to practice NCLEX style questions. You have, honestly, like, you can still pass a test even not knowing any of the information. If you know how to answer the question and if you know what they're asking, it's always priority, delegation, and appropriate person for the task, usually. Or, I mean, once you get to medication, it's a different ballgame. But if you know how to answer NCLEX style questions, you will excel. Like, it's so much easier. So if you do practice questions, practice makes perfect. I mean, kind of like lame to say, but it's honest. Like, if you practice, you will do well. So that's my advice to you guys. And I would also advise you to I use NRS&G. I'm sure all of you guys have seen my story that I'm always posting about it, and my honest review is it's a phenomenal tool. It's very concise. If you don't like watching like 45-minute lectures, it's perfect. It's detailed, it gives you a guide, it gives you notes, it gives you all the information that you need for specific disease processes. They now have NRS&G Academy, which I love because it's more concise. It's, if you want to study cardiac, you can study cardiac, and it's like specifically made for nursing students. And you can try it out for $1, I believe. I tried it out for $1 originally, and then I signed up for the subscription because it was actually great. I would advise doing that. And let's talk about this guy. I have an iPad Pro, and I love it. It's compatible with the iPencil, and that is how I take my notes. I'm sure you guys have seen my stories, and I'll post on Instagram that I am an avid user of my iPad. I use it all the time for my notes, or my books. It's absolutely like my best friend in addition to my dog. So I'll show you guys a little preview of my pharmacology notes. So this is the note, this is the app Good Notes. This is my pharmacology notes, a little preview. So this week we're studying analgesic drugs. And I copied this from our PowerPoint in class. And then I wrote little notes on here. And then I also wrote notes here. And this is analgesic drugs and their mechanisms of action. And I just think it's so helpful to have it with you all the time. So like, God forbid it rains or something, or you leave your backpack out in the laundry room and it gets super wet, and then all of your notes are wet. That's my worst nightmare. So having the iPad, it backs it up to my email, to Gmail, to my Google Drive, and I physically have it with me all the time without having to carry a bunch of notebooks. I think it's a great tool. It's kind of pricey, but it's worth the investment. Last recommendation I would make for nursing students is to have a nursing friend or two. I will say this until I'm blue in the face. It's so important to have someone like-minded. I posted about this yesterday. Like-minded individuals with the same goals as you. It's so much easier to get through